three sectors where the maximum number of graduate jobs are. It's always been the same. It has not changed the last 2 years. Number one, IT ITES. Second is banking. And third is healthcare. Unfortunately, many people don't know much about healthcare. There's a lot of action happening in startups. The startups, largest number of startups are coming in healthcare sector, both in terms of devices, both in terms of therapeutic solutions. And obviously, people believe that even things like machine learning, artificial learning will all come in healthcare sector. So if I were to pitch one sector where they should look at seriously, it's healthcare. But you look at healthcare, it's broadly divided into diagnostic devices on one end, the other end is drugs and pharmaceuticals and hospitals. Hospital sector has never got attention from the MBA schools. It's always been thought that you need to deal with doctors and therefore you need to have an MBA after a doctor is the most logical choice. But that's not enough numbers are available. The number of hospitals coming up, nursing homes coming up is much more than what any of this specialized and doctor MBAs can do. So I would pitch for one big sector is to work on administration or management of hospitals. And one of the biggest challenges in hospitals today is to manage three broad areas in a hospital. One is acquisition of patients. It's a highly competitive field. There are a lot of referral plans running between GPs referring something to the hospitals. So there's a huge amount of thinking, a lot of ethical issues, a lot of other operational issues in getting customers in or patients in. The second is managing the entire gamut of insurance. Percentage of people with insurance into hospitals are growing consistently. There was to be 10% earlier. Now I've heard somewhere 30% of the people walking into hospitals are medical insurance people. So insurance claim is a very complex process. Doctors cannot understand this. Any stretch of imagination, they find very difficult to maneuver this. The third portion, which is also very critical, is managing the non-doctors or the support staff. So to my mind, hospitals is a very interesting sector. Many of the colleges don't understand this segment very well. Let's say I'm an MBA college, I want to bring more hospital administration. I'll have to tie up 3-4 hospitals and tell them what you want them to know before coming and joining you. So we have to put the finishing school model towards the end of the course, that is in the last semester. Supposing, let's say, 4 hospitals are saying we are willing to become MBAs, provided they know procurement better, provided they can do patient acquisition better, they do digital marketing better. Then we do a 15 days, 30 days specialized program. In the context of healthcare, in the context of hospitals, how do you bring in that specialization in that domain so they become useful? I'll talk about one portion of banking where there is there's opportunities, but they're not looked at seriously by the MBA schools. But the awareness of IT ITES is very high and is already saturated. There is no hope for MBA school students going to IT ITES the way it used to be earlier. So I would say hospitals, if you want to really get a focus, you need to go talk to some 8-10 hospitals around your geography. Get them into a room for a discussion, saying what kind of people they need right now. This is the time for MBA schools to wake up, to say that they have sold the dream of this consulting and sold the dream of business analytics to students. That dream is not going to work.